All right, so we are back to finish up our heart notes. Last time we finished up, we'll just pull that up here. We finished up with looking at the different valves of the heart. So that's going to lead us into the sounds that your heart makes, because the sounds that your heart makes are actually made by the valves as they open and close. Okay. So when we're listening, if you listen to a heartbeat, you're hearing the different valves of the heart open or close at different times. The valves, as we said before, they control the flow of blood from the atria into the ventricles, or from the ventricles into an artery leaving the heart. Their purpose, again, is to prevent the backflow of blood. So we don't want blood to come from the ventricle up into an atrium, and we don't want the blood to come from an artery back into the ventricle. So the valves help with keeping that from happening. So as I told you with the last lesson, there are going to be some blood vessels that you're going to need to know. Okay, we're going to go through what we call the great vessels right now. The arteries you're going to need to know are going to be the aorta and the pulmonary arteries. Okay, so the aorta is going to leave the left ventricle to carry oxygen-rich blood to the body. Your pulmonary arteries are going to carry oxygen-poor blood from the right ventricle to the lungs. Okay, so with the veins you're going to need to know, you have the superior and inferior vena cava, and they enter the right atrium. They're going to be carrying oxygen-poor blood from the body to the right atrium. And then you have pulmonary veins coming from each lung to the left atrium. Okay, now normally in our body, our arteries are going to have oxygen-rich blood, and our veins are going to have oxygen-poor blood. The only place in our body that is flipped is with your pulmonary arteries and your pulmonary veins. Okay, so on a diagram, when it's colored, you're going to see pulmonary arteries being blue, typically, and pulmonary veins being red. All other arteries you would see, like the aorta, would be red, and all other veins you would see, like the superior and inferior vena cava, would be blue because of oxygen-poor blood. Okay, so the only place that is flipped, again, is with the pulmonary circulation. So here you can see, if we take a look at the location of these, they're underlined in red for you here. So the superior vena cava, bringing blood to the right atrium from the upper body. The inferior vena cava, bringing blood to the right atrium from the lower body. Blood would leave the right ventricle through the pulmonary trunk, which again splits into the left and the right pulmonary arteries, and those are labeled. Then you have two pulmonary veins from the left lung, two pulmonary veins from the right lung, bringing blood to the left atrium right there. It'll go into the left ventricle and then out through the aorta, and that's underlined as well. So those are going to be the blood vessels that you do need to know, the ones that are underlined. Okay. Now, if we take a look at blood flow through the heart, there are lots of steps, and the more you know the anatomy of the heart, the easier it's going to be for you to remember the blood flow through the heart. Normally, we start with blood entering the right atrium. Okay, so blood is going to go through the superior and inferior vena cava, and they're going to empty their blood into the right atrium, that top right chamber of the heart. From the right atrium, the blood's going to go through the tricuspid valve into the right ventricle. From the right ventricle, blood is going to leave the heart. It's going to pass through the pulmonary semilunar valve, or the pulmonary valve. It's going to go into the pulmonary trunk. That's then going to split into the right and left pulmonary arteries, and that blood gets taken to the lungs. Okay. If we continue that, oxygen and carbon dioxide are going to be exchanged in the lungs, and then oxygen-rich blood returns to the left atrium through the four pulmonary veins, the two on the right and the two on the left. That blood is going to go into the left atrium and go through the bicuspid valve into the left ventricle. From the left ventricle, the blood is going to leave the heart through the aortic valve, or the aortic semilunar valve, and into the aorta. And then from there, it travels to the rest of the body. At that point, when it goes to the rest of the body, once it doesn't have oxygen anymore and it's oxygen poor blood, it's going to go back through the inferior and superior vena cava. So we can go back through these steps and then to these steps and then back to these steps and then to these steps, because that process just continues over and over again for, really for as long as your heart is beating. That will happen. Okay. So what is happening when our heart is pumping? Okay. So our heartbeat is going to begin when the heart muscle is really relaxed, actually, and then blood is going to go from the vessels into the right atrium or to the left atrium, either from the body or from the lungs. Next, the atria will contract. That opens the tricuspid valve and the bicuspid valve and lets the blood go from the atrium into the ventricle. Next, the ventricles will contract. That forces the tricuspid and bicuspid valves closed so that blood can't flow backwards, and pushes blood out through the aortic valve or through the pulmonary valve into the aorta or into the pulmonary arteries. Okay. When this is happening, you can see on here that the atria are refilling with blood. Okay, so that cycle just continues over and over again. So you'd have blood entering the atria because they're relaxed. Atria contract, that pushes them through those valves. When the ventricles contract, the AV valves are forced closed and the blood leaves the heart. While the blood's leaving the heart, the atria are refilling. So that just happens over and over again. Okay. Here we have, again, just another look. We're going to do a lot of looking at these different diagrams, so this one's a little bit different, but still going through the blood flow. Okay, so you're going to need to fill in each circle with the corresponding number, and it has the steps listed over here. So the first thing that happens, okay, we're going to start inside the right atrium. Blood's entering the right atrium from the superior vena cava and the inferior vena cava. Blood is going to flow through the tricuspid valve into, right here, the right atrium, or right ventricle, sorry, from the right atrium. Step 3, the right ventricle will contract, and that will push blood through the pulmonary valve into the pulmonary trunk. Okay, so blood flows through that valve into the pulmonary trunk. That's step 4. Blood is going to go through the right and left pulmonary arteries. Okay, so that was step 5. Then blood would go to the lungs from there, and you would have the exchange of oxygen and carbon dioxide. Then blood would come through the 2 left pulmonary veins from the left lung and the 2 right pulmonary veins from the right lung into the left atrium right here. Steps, what are we on? 7. Blood is going to be pumped through the bicuspid valve or the mitral valve into the left ventricle, which is this chamber down here. And then we have when the left ventricle contracts, that's going to pump blood through the aortic valve into the aorta up here. The blood would go from the aorta to your body, and then it would return to the right side of your heart from the superior and inferior vena cava. Okay. So we will do more to practice this, but that's just looking at that again on a different diagram. Okay. Again, one more time, I will point out here that the wall of the left ventricle is thicker and stronger than the wall of the right ventricle. And that's just based on, or the reason for that is because of where that chamber has to pump blood to. So the right ventricle only pumps blood to the lungs, and the lungs are really literally on either side of the heart. So it doesn't have to pump blood very far. Okay, so it doesn't need to be as strong. The left ventricle has to be strong enough to pump blood out of the heart to the whole rest of your body. So it needs to be a lot stronger, and that's going to be what accounts for the wall being thicker there. So with your heartbeats, what we say, I don't know why this is on here twice. Okay. The sound of your heart is lub-dub. Okay, so when it's making like this, the words we use, I guess, to describe the sound is lub-dub. Okay. What's happening is you're hearing, again, with the lub and the dub, you're hearing the AV valves and then the semilunar valves opening and closing. Okay. Inside of your heart, and I'll actually go ahead really quick and then I'll come back to this. There are cells that kind of have an electrical signal to them. Okay, so right up here in the upper wall of the right atrium, we have what we call the SA node. And then down here at the bottom of the right atrium, we have what we call the AV node. Okay, so let me go back here. The SA node, or the actual name, is called the sinoatrial node. That's a group of special cells in the wall of the right atrium. And we refer to that as the pacemaker of the heart. So those group of cells in that part of your right atrium are responsible for controlling your heartbeat and getting your heart to work all together. That AV node, or atrioventricular node, is going to get signals from the SA node to electrically connect the atria and the ventricles. So again, that your heart is beating kind of in unison. So if we look here, in the walls of your heart, we have these special fibers. You could think of them almost like electrical wires, okay? We call them Purkinje fibers, They're going to get signals from the SA node to the AV node to get the ventricles to contract together and to get the atria to contract together. What we have left to talk about are some issues that can happen with your heart. The first that we're going to look at is a heart attack. Now, the technical name for a heart attack is called a myocardial infarction, or an MI. What causes an MI is when one of the coronary arteries gets blocked. Okay, so that's going to prevent oxygen-rich blood from getting to the heart muscle. And part of the heart muscle can actually die if it, is blocked long enough from getting oxygen-rich blood. And then if it is severe enough, that is when a person would die from a heart attack. But heart attacks are not always fatal. The coronary artery, because that is what would be blocked, you may have heard a heart attack also being referred to as having a coronary, because the coronary arteries would be blocked in the case of a heart attack. Some symptoms of a heart attack, these are going to be really important to know, because you could potentially get medical help for you or for somebody else that's having these symptoms in enough time to get them help to stop the heart attack from becoming severe or becoming deadly. There are treatments they can do for you, okay, if you can get help in enough time. So symptoms, you might have chest pain or just kind of a feeling of tightness or discomfort in your chest. So it might feel like pressure, like somebody's sitting on your chest. You might feel like a squeezing pain in your chest, or just feel really full even though you might not have eaten anything. You could feel pain, and it can even feel like heartburn or indigestion. You would have possibly shortness of breath at rest, so you'd be sitting there but kind of not able to catch your breath. You might have some upper body discomfort, so a common sign is pain in the left arm. Okay, so if you know somebody is having pain in the left arm, that is a very common sign of a heart attack. You might have back pain, you get pain in your shoulders, in your neck, pain in your jaw. That seems to be a more common symptom for women than men. Some other symptoms, you might break out in a cold sweat. You might feel really, really tired for days, and that's another sign if you are a woman. Possibly feeling nauseous and vomiting even. Might become lightheaded or sudden dizziness out of nowhere. Or if you have been having some of these symptoms, but then all of a sudden you have a new symptom in addition to those, or a change in a pattern of the symptoms you've already been experiencing. So for example, like maybe you've been having chest pain, but maybe it becomes more severe, or the chest pain lasts longer than it had been. Okay, those can all be signs of a heart attack. So what to do in the case of a heart attack is to call 911. If you have aspirin available, you would want to chew and swallow a full strength aspirin, which is 325 milligrams. The reason why you would want to chew it and swallow it is to break it down faster than just letting the pill dissolve in your stomach. And the reason why you would want to take aspirin is because it's a blood thinner. So if there is maybe like maybe the blockage in the coronary artery isn't completely blocked or completely blocking blood flow, if you get a blood thinner, that can allow some more blood to pass around the clot and get to the heart muscle to keep it from dying. You also need to get to the hospital, and that should either be by ambulance or having someone else take you if you are the person experiencing these symptoms. You should never try to get yourself to the hospital. You would want to do that via ambulance or another person who is not having a heart attack. So here we have some treatments. So with, in the case of a heart attack, we have some surgical procedures that are options for treatments. One is something called a cardiac catheterization. I'm going to show you part of that really quick so you can see what that would look like. We're not going to watch this whole procedure, but let me actually mute this. Okay, so there is a person under here. What they would do in the case of a cardiac catheterization is something with, they would make an incision in the groin, and they would kind of feed what's called a catheter or like a wire up through, he's injecting some dye. The catheter is already placed in the femoral vein or femoral artery, sorry. So the dye that they're inserting will let them see blood vessels show up on a screen. So let's see if we can go ahead here. So here you're seeing that they placed the catheter wire. Okay, and let's go a little further. So you can see that's the dye letting you see the blood vessels on that side of the heart. Okay, on this side of the heart, okay, so this is the side of the heart where he did not have the heart attack, and you can see the blood flowing through there. And then let me try to find a little bit further so we can see where they actually do. Okay. So they are going to feed a wire up through the catheter that they put in, and they're going to do what's called an angioplasty. So there's a little tiny balloon that they're going to, let me pause this actually. Okay. There we go. I think this is where I want. Okay. So they're feeding this balloon with a wire up into the heart from the groin. And they're going to find the blockage this way. So they see where the blood flow stops, and then they feed the catheter to that part of the heart. All right, I think we're getting to the good part here. Here we go. This is what we want. So You can see the one side of the heart where we have full blood flow, because what you're seeing there is the blood vessels. The way you're seeing those blood vessels show up is that they injected dye into the person's blood. And then, come on the other side of the heart, we can see where the blood flow is actually stopped. There we go. So if you see here, the blood flow stops right there. So that's how they know where the clot actually is. And they're able to go in. They're going to use this balloon kind of thing. It's a very small balloon, but it goes, they feed it right into that area, and they try to push it past the clot. They're going to try to remove some of the clot. And then with the balloon, let's see, they'll show that to you soon. Here we go. So there is a small tiny balloon in that tube, and around it is something called a stent, which is a small piece of like mesh metal. And they're going to inflate the balloon inside of that vessel after they get the blockage clear. And that's going to push the stent, that metal piece that's hard to see here, but it's there, over, they're going to push that into the wall of the vessel to permanently hold it open. Okay. So you can see there's some blood flow there because they got some of the clot out. And you'll be able to see when they get the full blood flow back, when they have the clot fully removed out of the way. I don't want to fast forward here because I don't want you to miss it. It should be coming up soon. Okay. So once they have that blockage cleared, then you can see that there's blood flow restored again to that side of the heart. Okay, so they would use that stent, and let me go back here. Okay. So that cardiac catheterization is a procedure that involves the balloon angioplasty and the stent placement. So that what we just saw happen is all of this here. Okay. The balloon angioplasty they would do with the cardiac cath. So they make, or the way they check for blockages is through the cardiac cath or cardiac catheterization. The balloon angioplasty, the balloon they use to press the blockage if it's plaque against the wall of the vessel. And then the stent, they put it around the balloon, inflate the balloon, and the stent is pushed into and becomes part of the vessel wall to hold it open permanently. Another procedure is something called a cardiac bypass surgery. We'll watch that quickly. That's a much shorter video anyway. After, of course, our lovely little ad here with your little mask guard. Okay. So with what we're looking at here is essentially an open heart surgery called a cardiac bypass. Okay, what's going to happen is if there is a blockage in the heart, you are going to be seeing this woman's actual heart here, which is down here in that part here. This vein here, let me pause that real quick. Oh, it's blurry. This tube here is a vein that they harvested, they took from her leg, and they're going to use that to bypass or go around and let blood flow go around a blockage in her heart. Okay. We can actually listen to him here, I guess.
This will kink. You don't want to have something that can kill a patient very quickly. So you go like that.
So they have a line on the vessel so you can tell it does so that it doesn't get twisted.
You want to make sure you're straight all the time.
If it's twisted, then the blood flow won't actually happen. It'll get blocked.
They have a lot of flow in them.
So right here you can see her heart beating.
Now we're going to put the patient on the heart-lung machine. Okay. So on bypass, please.
So when they're saying go on bypass, they're actually technically killing her. They're stopping her heart. They're hooking up to a machine that's going to pump blood and essentially breathe for her so they can do this procedure on her heart.
A heart-lung bypass machine creates an artificial circuit of blood flow outside the body while the heart is being repaired. Heart surgeons connect tubes to major blood vessels, detouring blood into a container. An oxygenator acts like the lungs and constantly replenishes the blood with fresh oxygen. The newly oxygenated blood is picked up by the pump, which acts like the heart, sending blood back to the rest of the body. So while the heart and lungs are bypassed, the cells in the body still get the oxygen and nutrients they need to stay alive. Once the bypass machine has been activated, it's time to temporarily stop the heart from beating.
Then we're going to put a needle in the heart in order to stop it now.
The solution in the needle is potassium chloride, a paralyzing agent that stops the heart.
You see how the red line there, this flat line now? That's the clinical definition of death.
The patient's
So
life is
technically
now
this woman is
100%
dead
supported
right now.
by the bypass machine.
All right, now the heart operation starts. I just put a hole in the aorta on purpose so we can sew the vein. Saline syringe fluid.
Now I'm taking the harvested vein and suturing the tip so that I can marry it to the opening that I just made in the artery. This is the definition of bypass.
Yeah, the lyric says we inject it, see it fills up nicely. And it's filling in very nicely down this artery that we just did a bypass graft.
Soon, the blood will be able to flow past the damaged areas of the heart. After working furiously against the clock, the heart has been starved of blood for almost an hour. It's crucial we start the heart now. The longer the patient is on bypass, the higher her risk of death.
We're about to restart the heart.
The heart must remember to beat on its own.
Clamp is off.
This is the moment between life and death.
Right up all the way, head down. This is the moment of truth.
So he's literally jabbing his fingers into her heart to try to get it to remember how to beat.
You see that? So we can electrically stimulate this. This is the healing. There it goes. Pop. And now it's picking up on its own. It knows the beat, but you got to remind it in the very beginning it's a little bit of an issue. So far, she looks pretty good. You're never out of the woods until the patient wakes up all the way, but I'm encouraged.
All those nice little ads that popped up there. So that treatment is, again, when they take a vein, usually from the leg of the own patient, and they're going to basically connect it so that there is blood flow restored. So if there is a blockage here that can't be fixed with the balloon angioplasty and a stent placement, if it's too severe, they will, so then blood should flow all the way through here, but they would take the vessel and allow blood flow beyond the point of the blockage so that blood flow can be restored.